Hello, this is Dr. Z from drzforlife.com. I've had a lifelong interest in healthcare and spent a lot of my free time reading about healthcare issues. And more evidence, clinically controlled evidence, is emerging that shows that most of the chronic diseases that we suffer from today can be largely prevented or at least slowed down markedly by diet and lifestyle changes. Many people feel that they're eating a very healthy diet, but without counseling regarding the vast amounts of processed food that the American public is exposed to, many people may not be eating a very healthy diet, even if they strive to do so. Also, the American medical system and Western medicine, allopathic medicine per se, has gotten to a point where often people expect some kind of medication or treatment when they present to a physician. Not given that pill, antibiotic, or other quick fix, people feel that they didn't get their money's worth of the doctor. I often see diabetic patients who may have been treated for type 2 diabetes for a decade or more with oral medications followed by injectable medications and eventuating in insulin injections. I'll ask these patients what they had for breakfast that very morning, and more often than not, they had something like biscuits or breakfast cereal. These patients have never been counseled regarding the deleterious effects of processed food on their insulin sensitivity and the development of type 2 diabetes. It's amazing to me. Here is a recent article. This article is from a group of about a dozen doctors in Pittsburgh, and what it says here is the effects of diet and physical activity interventions on weight loss and cardiometabolic risk factors in severely obese adults. The long and the short of this paper is that they took about 700 men and then teased out about 300 out of these 700, essentially based on motivation, ability to walk, etc. So they actually pre-selected for a population of men who would agree to these types of lifestyle interventions. What types of lifestyle interventions did they propose? They asked these men to eat a lower calorie diet, typically 12 to 1,500 calories a day, composed of about 20% protein, about 20% fat, neither one of which I have any problem with, and then about 70%, I guess it was more like 60% carbohydrates. No mention is made of the type of carbohydrates, whether they be highly processed carbohydrates, which honestly is what's killing Americans today, or whole grains, or carbohydrates available in vegetables. No mention whatsoever of the nutritional content of the food. It's hard to believe. Nevertheless, this group of pre-selected, highly motivated men did lose weight when put on a lower calorie diet. They also pointed out that the men who were subjected to some physical activity, approximately 150 minutes of physical activity a week, meaning walking most days of the week for 30 minutes or so, led to increased weight loss, improved waistline measurements, improved liver functions, less fatty liver, and decreased blood pressure. Amazing. Exercise and a healthier diet lead to increased weight loss. Now, these physicians were careful to point out that bariatric surgery, though only available to approximately 1% of the most obese adults, is not to be replaced by lifestyle and dietary interventions, only augmented by it. That this paper is published in 2011 and actually states that no other randomized controlled trial of diet and exercise has ever been performed, and that this was presented in the Journal of the American Medical Association, is frankly astonishing. That's Dr. Z for Life. I'm Dr. Z. To your health.